Hello, good morning everyone. My name is Dr. Sheetal Vaidya. I'm a specialist OBGY at Unicare Medical Center since the last 4 years plus. My contact information is already on the slide. So let's start the topic. First of all, I'd like to thank Muzaffar and his team for organizing this and your team for making you aware about the Breast Cancer Month. So as we all know, October is the Breast Cancer Awareness Month. And the only reason October has been given is that they want women and men to be reminded that every year a breast checkup by a physician is very important. It's not that you can't do the checkup through the rest of the year because breasts are an integral part of the body. But October is just a reminder of the same. Now let's get on to the breast cancer myths. So the first myth which women feel is that only women with family history of breast cancer are at risk, which isn't the truth. The fact is, women who do not have breast cancer history in their family also get breast cancers. One of the recent diagnoses of young women with breast cancers had no history of family breast cancers. She was as young as 28 years old. The second is most breast lumps are cancerous, which is not the truth. So 90% of the lumps are non-cancerous or benign. But when you go on Google and search it up, the first thing that comes up is a breast lump is cancerous. So do not panic when you have a breast lump. The third being only women can get breast cancer. Well, again, a major myth in today's world because the last year itself, 2,550 men have been diagnosed with breast cancers. Breast cancer always comes in the form of a lump. Well, that's not true either. So breast cancer can come in the form of a lump, no lump at all, no symptoms, skin rash, discharge, blood-stained discharge, and lot many more. Now let's see the structure of a normal breast. So the breast is basically made up of four integral parts. The first is known as the nipple area where the duct, centrifuge, and the central part. Around it is the lobules, which are actually used for breastfeeding when a mother feeds the baby. The whole structure is held by stroma, which is made up of fibrous and fatty tissue that makes up the structure and holds the breast on the pectoral muscles. Draining all of this is something that's called lymph vessels and lymph nodes, which drain all the way up into the axilla. I'd like to say one thing about this, that the breast structure stays same in the men and the women. The only difference is the amount of stroma and fat tissue is high in women depending upon their structure. Now let's get on to what is a normal cell division and what is cancerous cells. So as we know that when we get hurt, we usually tend to heal within a few hours or a few days time. That's called a normal cell division. However, when some kind of abnormal thing happens during the cell division, it tends to produce abnormal cells, as you can see in the image at the top. This abnormal cell or injured cell is known as a cancerous cell, which divides into abnormal cells again. So a healthy normal cell divides into one cell into two, two into another two each. However, in cancerous cells, the control over the cell growth has gone. And that's the reason the cells keep dividing at a very faster rate and in multiple different ways. So one cell does not give rise to two, it can give rise to 6, 10, 20 also. That's how cancer cell division is faster than a normal cell division. Now, what's the difference between a benign tumor and a malignant tumor? So benign tumor is something which is not a cancer or a tumor, and the cells tend to grow only locally. They do not spread. So the benign tumors are usually non-cancerous. As I already said, 90% of tumors of the breast are benign or not cancerous. What happens in malignant tumors? When these cells start growing repeatedly, they invade the local spaces, then they invade the spaces of surrounding structures. And after that, they tend to invade through the blood vessels and the neighboring tissues. And then they metastasize to other parts of the body. This is typically a malignant tumor or a cancer in layman language. Now let's talk about the pink initiative. So I take pink in the form of things that we practice. So P stands for practice what you know. What do we know? We know that we need to eat healthy, we need to stay healthy, be active, not smoke, and avoid alcohol or any substance abuse as far as possible. Then comes investigate. So we need to investigate the information, but with the right sources. Let Google not be the source of our information because it usually gives panic. N. N is knowing what is normal. And that's the reason I am here to tell you that knowing the normal breast structure is very, very important. The last, knowledge is power. And let's take the knowledge from the right person, which is a paramedic, a medical person, a physician, a midwife, somebody who actually does the breast examination and has the right information. We do not want people who have studied from Google and are imparting information. So believe the right knowledge. That is very important. Now let's talk about the risk factors of breast cancer. So the first risk factor is age. That's something which people get amazed with. How come age is a risk factor? So yes, we all know that most of the cancers tend to happen after the age of 40 when the cell division becomes abnormal or the oxidant levels in the body increase a lot. However, for breast cancers and ovarian cancers, age has a different role also. Age plays an important role, especially in women who have had an early onset of menstrual cycle or a late menopause. So the exposure of the body and the organs to the continuous estrogen is for a higher duration of time. Similarly, the first pregnancy happening at an older age, which does happen very commonly nowadays because of late pregnancies due to career, social issues, and many more circumstances. So age plays a role because when there is increased risk factor due to increased exposure to estrogen. Then comes race. So we all know different races have different genetic makeup, and that makes a lot of difference in the type of cancers they are, whether they are aggressive, early diagnosed, late diagnosed, and these depend upon the type of race. So the part of the world that you belong to and your ethnic genetic culture. Individual or family history of breast cancers and a history of ovarian cancer. So the breast and the ovarian cancers are both end organs. So the breast and ovary are affected by the hormones secreted by the pituitary and the amygdala and the pineal gland that secrete hormones for the body. And then they affect end organs like the breast and the ovary. So any individual history or a family history of any one of these cancers does tend to increase the chances of risk of breast cancer. Then comes estrogen exposure. Estrogen exposure is very common in today's world. Number one cause is usually the contraceptive or the birth control pills. And the second is hormone therapies, which also have some or the other forms of estrogen. Lifestyle factors, we will be discussing that at the end of my presentation, which is like obesity, lack of exercise, substance abuse, all these affect. Main are smoking and alcohol. Then comes radiation. So any form of radiation taken during the earlier part of life can increase your chances of precancerous breast changes, which in turn can lead to abnormal cell division and cause cancer. Last but not the least is a dense breast, which is seen during mammography, is also a high risk. Now, this is one topic which is very important and most neglected one. How do genes affect the BRCA1 and BRCA2? So BRCA1 and BRCA2 are breast receptor cancer antigens 1 and 2, which lie on 17 and 13 respectively. So women with these BRCA genes positive have been known to have a higher risk of breast cancers, which are more metastatic and malignant. I'm sure you've all heard about Angelina Jolie. Well, I'm not talking about her because of her acting or because of Brad Pitt. I'm basically telling you about BRCA gene and Angelina Jolie is because we all know that she went through an early premature removal of the breast. The reason being the mother, her aunt, and her cousin sister, all of them had lost lives due to malignant metastatic breast cancers. And that is why we need to understand for women with breast and ovarian cancers, these genetic structures can be detected. Those who have familial history or personal history, they can go through this test of BRCA1 and BRCA2, which is conducted across all parts of the world and it's conducted in UAE also. So you can get this done in case you have a familial or a personal history. And this can be very advantageous because that helps you improve your chances of diagnosing it early and also better survival and prognostic rates if you are diagnosed with it. Now, what are the symptoms of breast cancer? So the first being lump, we all know about it, any kind of lump or thickening, which is in the breast or even in the armpit area. The second being nipple tenderness, any kinds of discharge or physical changes happening in the nipple. And this is where knowing normal structure is important. Third is skin irritation. So any kind of puckering, dimpling, scaliness, any new creases coming in are also very important changes of the breast. If you've noted, as you see an orange, which is a soft structure, as it becomes stale, the skin changes that you see in orange is exactly how the breast changes also will be seen. That's puckering, dimpling, scaliness. And that's why, again, knowing normal is very important. Warm, red, swollen breasts like a rash can happen, but less often. Pain in the breast, which is usually not a symptom of breast cancer. However, it should be reported to a doctor if you do have pain with a lump. And the last is the main reason, and that is most of the patients are asymptomatic. So they have no visible signs or obvious symptoms. However, they are still suffering from a malignant tumor. This is just a pictorial depiction where you see a lump, pulled in nipples, dimpling, dripping, redness or rash, or any kind of skin changes. Now let's see how breast cancer is evaluated. So we all know breast screening is the most important, and this is done by either a midwife, a gynecologist, or any physician who will do the breast self-examination and teach you the same. Along with this, we use diagnostic mammography for women after the age of 40 years. At least 2 mammographies are to be done diagnostically as a screening procedure, and then we move ahead and customize the case. Then comes ultrasound. So ultrasound is a very important non-invasive first step tool in diagnosing further. This is followed by magnetic resonance imaging. Then comes a biopsy to confirm the diagnosis, because before we operate, it's very important to confirm the diagnosis. Blood tests and other tests are usually done to determine the staging and how far it has spread. The first being early detection. So we all know that visual inspection and careful feeling of the breasts, nipple, and the armpit and collarbone area is very important. So you look for lumps, skin changes, discharges. And remember, most lumps are not cancerous. As we all know that women do have premenstrual breast tenderness because of the hormonal changes. So the best time to examine breasts by the women themselves is usually after the periods. Maybe say day 4, 5, up to day 7 or 8 is usually the best. It's not 100% accurate, but it helps you know the normal breast and it helps you find out something abnormal too. How do you do a breast self-examination? This is one of the most important slides. So the first thing is you examine your breasts in the shower. Why the shower? Because that's usually a time where women find some few minutes to themselves, and you need undivided attention when you're doing this examination. The second is examine your breasts by looking at the breasts in front of a mirror. The first one being with the hands dangling on the side. The second one is with the hands raised. And the third one is with the hands rested on the pelvic bones. We'll all see that the breast shape changes as the hand position changes, because the breast is a loose organ on the pectoral muscles. And that's the reason visual is equally important. The third is you stand and press your fingers on the breast and rotate it. I'll be showing you how to do this in the next slide. You can do this examination standing and or lying down position. And the last thing not to forget is to check for discharge from the nipple area. Now, these are the 3 directions where you can do breast examination. The first one being you move across the breast from the central part, go downwards, again go up, and then again down. Before I explain all the 3 methods to you, I would like to tell you that how the breast examination is done. So you don't do it with your full hand. You use your middle 3 fingers. You don't use the upper part because that is too sensitive and you tend to overdiagnose a lump. And you do not use the lower part either because that has lesser sensations. So you tend to miss out on any kind of lumps. So what you use is the middle part of these three fingers. You rotate these in coin-sized circular motions all across the breast. As the first figure I said was, you go vertically down, then you go vertically up. Put in mild pressure and then move in the directions, that is examining the whole breast, and then moving to the armpit area. Similarly, the second one is starting from the outward area and rotating towards the inner part or the central part of the breast. And the third one, which is most commonly used by most medical practitioners or examiners, is to start examining from one corner of the breast in a circular motion, coin-sized, slow circular motion with firm pressure until you reach the central part of the breast. That is where you check the nipple for the discharge. And then you check under the armpit area where you see the muscles for any kind of lymph nodes. Now let's get on to the diagnostic. So we've already shown you this, the breast ultrasound, one of the commonest diagnostic and easiest non-invasive methods. The second is a mammogram, and the third is a CAD mammogram, which is a high-ended mammogram, wherein the patient lies on the metal plate. When to begin screening? So women with increased risk need to be screened very early. So the annual breast examination, we advise women with high risk to start at the age of 20. Now, as far as I know, at the age of 20, we are happy and merry go. You know, I would say a happy-go-lucky person where you care a damn about what is going on with the breast examination or even the changes. However, those people with high risk factors should go through clinical breast examination at 20 years onwards. An annual mammogram starting slightly earlier than a normal age, which is at 35, and self-breast examination and breast awareness, one of the most important steps in women having breast cancer awareness. Women with normal risk factors, as I already mentioned earlier, they are screened at the age of 40 and 42, or maybe two mammos after the age of 40. Once both of them are normal, you can customize it every 3 years or 5 years as your clinician tells you. Now, how does an ultrasound look? So as you can see the image at the top, the ultrasound shows all kinds of structures with different echoes because it's sound waves. The one with the black circle and black fluid inside, that is usually a cystic swelling. And the second one, where you see specks of white inside, that is a solid swelling. And that's the kind of solid swelling that we are looking for and we want to move ahead for further diagnosis. Whenever a mass is filled with fluid, it's not cancer, it's usually a cystic swelling. Cancers are solid structures because they're made up of tissues. And that is why ultrasound is the first step of screening. Then comes mammography. Mammography is where an X-ray picture of the breast is taken from several different angles after compressing the breast horizontally, vertically, and diagonally between two metal plates. Yes, a slightly painful procedure for a few seconds, but it can save your life in case you are detected with a lump. This is how mammogram images look. So something as small as a pea size can be diagnosed in a mammogram. And once that is done, we can do high-ended tests on further diagnosing it. That's an MRI. For an MRI, we usually use a dye. The dye actually engulfs the normal structure and you see the lump coming out of it, or you see it more visually seen. That is the black small structure as small as a pea size. So this helps in diagnosing whether the tissue is cancerous, dying tissue, or a normal healthy tissue. Then comes the needle biopsy. A needle biopsy is usually where some amount of fluid is put inside the lump that's saline with a needle, and then it's again withdrawn out, wherein it brings in cancerous cells along with the fluid, and that cancerous cells are usually examined. This is a high-ended test done under local anesthesia with ultrasound guidance and is 100% accurate because it shows you what kind of cells are exactly there in that lump. Treatment. So the treatment is customized depending upon the variety of lump you have, the age, the type of cancer cells, whether you want to preserve the breast, and lot many other issues. The first treatment is surgery, which is the best because surgical treatment removes the lump completely, and that way you rid yourself of the tumor completely. The second is radiation and chemotherapy, which can be given after surgery to reduce your chances of further metastasis or relapse, or it can be given before surgery also to reduce the size of a lump before operating it so as to save the surrounding tissues. Vaccines, we have not yet found definitive vaccines for breast cancer. And as far as hormonal therapy goes, tamoxifen is one of the most commonest used hormonal prescribed drug, which helps us in preventing relapse in patients with breast cancers. Well, I'll now come up with the good news because we've talked enough about cancer, I think. So there are ways of reducing your risk for developing cancer. And this is what I would like to focus on rather than focusing on when you get a disease, because prevention is the best defense. So the first prevention is breast examination, examining your breasts so that you know the familiar breast and you're familiar with what your breast is, what your normal breast is, and you can spot changes which can then be reported to a physician. Spread this message to each and every woman and men around you so that we can prevent women at an early age and protect them from further having severe complications. Can I prevent breast cancer? Well, the four main parts which can help in preventing any form of cancer, and particularly breast cancer, are maintaining a healthy weight, a regular exercise, and a good nutritious diet, along with breastfeeding. These are two things which play a very important role in protecting women from breast cancer. So breastfeeding is something which is recommended by WHO for at least one whole year. That's very important because that gives a break to the women from the estrogen affliction into the breast and the ovaries. And this break usually proves advantageous and helps you in protecting you from breast cancer. Limiting the substance abuse like cigarette, alcohol, and even birth control pills or any forms of hormonal therapy can also protect you in the long run. Now let's talk about nominal diet and lifestyle changes that can help you. The first thing, we all know, and Google teaches us a lot, that healthy eating is so important. But we need to understand that eating smart is important. It's not what you eat, but it's actually how we eat it, because no food is healthy or unhealthy. The only thing that is healthy and unhealthy is our diet, as in the way we eat things. So according to WHO, the fruit plate is usually covered with 30% of fruits and vegetables, which preferably should be raw, because the assimilation of the nutrients is best when they are raw or par cooked, and then comes the cooked varieties. The second being carbohydrates, which is made up of the bread, other cereals, pasta, potatoes. These are all complex carbohydrates, always better than simple carbohydrates. And the other third is made up of milk and dairy products, foods that contain high amounts of fat, and also mild foods that contain some amount of sugar. And the last part of this 30% is meat, fish, and other non-vegetarian sources. This is how a usual plate should look, or a usual meal throughout the day should have these three parts in equal amounts. So getting the balance right is most important rather than just shunning some parts of your diet or some parts of nutrients. Now, people often think that healthy eating is either you eat it all or nothing. But I feel that health, diet, and moderation, these go hand in hand. So the most important part of a balanced diet is, despite of all the fat diets that we have heard of, we believe that an equal balance of carbohydrates, proteins, fats, fibers, vitamins, minerals, all are needed to sustain and give rise to a healthy body. Now let's talk about a healthy diet. So it is said, according to the recent studies of 2019, that a healthy diet and lifestyle changes can actually prevent 40% of cancers. Basing our diets around plant foods like vegetables, fruits, whole grains, beans, and cereals that contain high amount of fiber and other nutrients can actually help in reducing the risk of cancer. Foods that specifically fight cancer because they help in killing the oxidants or the damaged products produced by our body are turmeric, carrot, grapes, citrus fruits like grapes, green tea, cauliflower, cabbage, broccoli, the flowered vegetables, garlic, onion, greens, tomatoes, very important sources to fight cancer. Now let's see how to pay attention to the food labels. We see food labels very often, but once we like it, we tend not to read the food labels, which is very common in today's fast life. So what happens here is this is how a food table is read. Anything above 20% is considered not good, and anything below 5% is again not considered good. So as you see in this slide, we are seeing that the sodium levels are 20%, the fat levels are 18%. So these are close to not being good, and even the potassium. However, things below 5% are the vitamin A, C, the iron levels, and the dietary fiber. I would like to mention dietary fiber here, which is the most important because dietary fiber is actually the fiber that helps in maintaining your sugar, your cholesterol, protects you from obesity and other lifestyle disorders. So when I eat this, I have basically eaten something that is a junk food. At the top of this part of the labeling is something where it's written serving size. So once I ate this whole packet, I thought I ate 250 calories of some junk food. But here it clearly says serving per container is 2. So I've actually gobbled up 500 calories of junk food. And then I'll end up burning it by running on the streets, which is not going to work because you're already taken in the poison, and after that you need to start working on it, which doesn't work that well. It's rather better not to take it at all. Water. Now let's talk about water. So everybody's water requirements are different. Some people require 1 to 1.5 liters and some people require as high as 3 to 3.5. It depends upon your basic activity level, the way you use your air conditioning, the way your lifestyle is, the kind of food you eat. The most important part is if you want to check the water intake, give yourself 3 to 7 days wherein you are drinking water when you are thirsty. That's it. And that will help you find out how much water you need at base level. And when you run, you can add on 500 to 750 ml each time. That usually helps us in finding out. So water is the most important part for all the metabolism in the body. And that is why drinking water throughout the day is important. Not that when you're at work, you do not drink water. You tend to avoid using the washroom. Well, avoid that habit and drink water more often. That's the most important. Now let's talk about this. So most of us are couch potatoes every evening or on weekends, just like this cat sitting with the remote and some chips and some junk. But when you do that, there's nothing wrong in that unless you have good amount of physical activity in your life. So find a buddy, a friend, a partner, companion, husband, wife, dog, cat, anybody who can help you and motivate you to stay active. The other two images show us what actually we are, that is literally stressed all through the day. And the image at the top shows us what our mind actually needs to be. We need to be calm to function at our epitome or to function best. Let's sum this all up. So as far as the diet and the lifestyle changes go, incorporating good food in your diet is very important. Changing your daily lifestyle and eating habits, again, very important. Reading the food labels right. Eating whole grain foods more often than processed foods. Drinking a lot of water. These three, the coming next three, are most important, which we tend to neglect. Using glass or steel storage containers. Try to avoid using plastic. Avoid using foil and non-stick in cooking because these are the ones that actually emanate a lot of chemicals in our food. And limiting the use of chemicals in general in daily use. Physical activity is a must, and I would like to put my importance on that at every single point. Relaxation techniques. You can use a lot of relaxation techniques to calm yourself down, to keep yourself sane and healthy. So deep breathing or pranayam is one of the best. Progressive muscle relaxations. Meditation again helps in healing your past, helping you look at a brighter future. Adequate amounts of sleep, because sleep is actually the repair time of the body, and that's most important. This is what is compromised where we work in today's world, because our days extend into 10, 11, 12, and 2 a.m. and our days start as early as sometimes 6, 7, or even earlier. So our sleep patterns are disturbed, and that disturbs our biological clock or circadian rhythm. Self-talk and imagery, again a very important tool. I'm sure you've all seen a video of a small girl and the father teaching her how to talk to herself every morning, and she's strong, she's pretty. So self-talk has a very important effect on the brain where it actually raises your self-confidence and self-esteem. So there are not going to be many people telling you through the day that you're the best, you're doing good, you look great. So why not do it for yourself? So self-talk and imagery with the mirror in the mornings is usually the best thing that you can start your day with, because it also helps you and fills you with a lot of gratitude. And this kind of attitude brings in the best in health and human. Physical exercises that can help you relax and still help you burn calories are things like Tai Chi, yoga, which are slow acting but work better in the long term. Now let's talk about one point that I've missed throughout this, and that is stress. So how do I decipher stress? Stress is the senseless thoughts repeated endlessly surrounding self. So my daughter's going to miss the bus. That is a stress that I'm dealing with when actually she's never missed her bus. So stress that can happen because of workplace, because of home place, because of past, present, or anticipating too many things about the future. So stress is usually surrounding ourselves, however, of different varieties. And that is why it's very important to deal with stress. And the techniques that I showed you in the last slide are actually very helpful to deal with that. This is my concluding statement that the modern life is actually full of lots of hassles, deadlines, frustrations, demands, and much more. For many people, stress is a commonplace. It's like their way of life. It doesn't matter to them. But stress isn't always bad. We need to realize that too. So, like when a small team of people are working towards a target, that stress looks bad, but it brings out a sense of achievement. So, you perform under pressure and it motivates you to do your best. So, work can be stressful, but it can be positive stress too. We just need to learn how to take it. When you're constantly running in an emergency mode, it's usually the mind and the body that pay the price. And you can protect yourself by recognizing the signs and symptoms of stress early in time and taking steps to reduce the harmful effects that the stress can have on our body, starting from psychosomatic disorders to additive factor of cancers and other lifestyle changes also. Thank you for being here with me. Let's add a little pink and think pink. Let's support the breast cancer patients and be aware about breast cancer as a whole. Thank you so much, everyone. I hope this session has been informative for you. Okay, so I'll start with the first one. My mother was diagnosed with RCC 1 year before, and she had nephrectomy already. Currently, we noticed 3 small lesions in the lung. What is the relation between breast cancer and lung cancer? What do you advise for my mother? Okay. Okay, so basically, in such cases, this usually the lung cancer can be number one, a separate tumor or a different variety of tumor, or it can be a metastatic lesion from the breast cancer. So I would advise your mother should actually meet oncologist at the earliest, and then they will guide you accordingly how to move ahead with either an operative procedure or chemotherapy and radiotherapy. But remember, when diagnosed early, these are all treatable. So let's stay very positive at any point of time. If you need any help, I will put in my contact slide again, and you can contact me on my mail ID again. Okay, thank you. I hope I've answered your question. Usually after removing the breast due to breast cancer, the fluids accumulate in the arm near to the surgery area. What are the causes and how can it be treated? Okay, so after any kind of operative procedure on the breast, especially breast cancer, because you've removed a huge lump and the lymphatics are still there, so they're actually draining that area. And the lymphatics, as I showed in the structure picture of the breast, they lie towards the axilla or the armpit. And this is why the swelling happens around the armpit area or the corner area, and from there it can spread towards the arm. Usually, exercises and physiotherapy can help you tremendously. There are other ways which can help in lymphatic drainage. If you need help regarding that, kindly contact me on my email ID. I'll put it at the end of the presentation. How much liters of water should be consumed ideally? Okay, so this is something which is very generalized, but I'd like to say I would customize it to 2 to 2.5 liters on an average for everyone. Some people require a little less, but most of us require this much amount. So I would say an ideal amount would be 2 to 2.5. If you're working out more often, if the kind of foods that you eat require more water, you might require 3 to 3.5 liters of water. But do not guzzle down water, because water is actually one of the best medicines for every single thing in this planet Earth. So water should be taken very consciously and very positively. Each sip at a time, we tend to stand up and guzzle water, which is like opening a tap. It's not going to give us that effect what would come actually by sipping through amounts of water. Can you please help with the copy of the presentation? I will ask the organizers to do that for you, and that should be enough. Is there a specific age after which breast cancer can develop? Yes, usually it develops above 40 years, as you've already said, and it can develop early in people with histories of familial or personal breast or ovarian cancers. And there are diagnoses in many women below 30 years also, wherein they have diagnosed with breast and ovarian cancer, skin cancers, in spite of being below 30 years with no familial history. So it's not a generalized rule. This is just a ideal situation that we show, but exceptions always happen. Is cancer hereditary? I would not say cancer is hereditary, but yes, the genetic structure that you inherit from your parents and grandparents is hereditary. So if you have a link which shows high amounts of BRCA1, BRCA2, it has been shown that you have a higher risk. It doesn't mean you will be getting it. Okay, so what is the effect of prolonged breastfeeding? My son is 2.5. I'm still advised by my family to continue. Okay, so Irene, at this point of time, I would like to say that breastfeeding is a very, very important tool. However, beyond the age of 12 months, it is not recommended only for two reasons. Number one, the child is already having enough nutrition from outside. The child is actually just suckling onto the breast because of the warmth that it feels from the mother. This detachment between the mother and the child is equally important for the individual development of the child. And that is why 1 year is what we recommend. Um Post 1 year, you can wean the child at any point of time. You do not need to feed the baby until the baby's actually got all the teeth. The nutrition comes better from other foods rather than breast milk. And the second thing which I would like to state here is after 1 year, the amount of nutrition that you're feeding an elder child is much more. So the mother loses a lot of nutrients during this process. So up to 1 year is ideal and best. Is it a myth or fact sleeping with bra may cause cancer? Okay, I would say this is a myth. Sleeping with one does not cause cancer, but yes, continuously wearing wired bras does tend to change the structure of the breast and the internal tissues. That makes you prone to breast lumps, not breast cancers. Is it normal to have one breast smaller than the other? Yes, it is very common to have discrepancy in the sizes of the breast. It can depend on two things mainly. The first is genetically it is different in size because of the structural development. And the second being breastfeeding on one side when it is higher and the other side is lower, that tends to cause discrepancy also. Can men have breast cancer? Yes, absolutely. In the year 2019, 2,550 men have been diagnosed with different stages of breast cancer. So any kind of lump for the men is also equally important. Is the screening process same for both male and female? So as far as the screening process goes for males, it is slightly different. What I've mentioned here was for the females. For the males, it's most important that they do know the regular structure of the breast or the normal structure of the breast. If they have a familial or a genetic trait that is running for any forms of cancer, these men should get breast examination done from a general practitioner or a physician or a surgeon at least once or twice in 2 years. That should be more than enough. Um, Thank you so much, Cheryl. I know how important awareness is. Okay. It was an accidental diagnosis. Okay. So basically, I would advise women to go through BRCA test because it is a very important test that helps you and protects you to diagnose cancers early in life. And women with history in family or self-history usually do show positive BRCA1, BRCA2 antigens. Those having ovarian cancers can have higher risk of breast cancer and vice versa. So doing the BRCA test is best. Inflammatory smear, that's fine. It's not related to breast. So what is the ideal age to do a test? Okay, so as far as ideal age for breast cancer, as I said, self-breast examinations should start as early as 20, 25 years age. But regarding the mammogram or ultrasound, you can do that after 40. And breast examination by a clinician is what we advise once a year, at least starting by the age of 25 or 30. If familial history, start early. No, sagging breasts is not dangerous. It basically means that the fatty tissue is higher and the connective tissue holding the breast has sagged down with age or due to hormonal changes. There is nothing dangerous in that. Such a great, but okay. Okay. Thank you so much for the appreciation, Jenny. How can we check traces of cancer after chemo? Okay, this will need a detailed array of tests like CA125, CEA, and specific antigens after the cancer has been treated. And that can be done by your oncologist or an oncology setup where all these are regularly done. Okay, can microwave radiation cause cancer? Okay, so microwave per se does not cause cancer. It's not that you don't do anything, but you use a microwave so you get cancer. But we need to understand. I'd like to show you an experiment which you can Google later. There was one experiment which actually showed a young girl doing experiment with plants. So she took one glass of normal temperature water, one glass of hot water, and another glass of, sorry, cold water, and another glass of water that was heated in the microwave. And when she used this for the same kind of sapling and seeds, the plant that grew were very different. The other two were actually working well, absolutely fine. The problem that happened with the microwave plant was it grew stunted, it grew lesser, there was no flowering, and very soon there was no life left in it. So yes, there are radiations caused by microwave. We see a lot of videos about it on Google and YouTube also. So microwave adds on to the radiation exposure. It does not cause cancer per se. I would still say using microwave should be the least possible. But I know that living in this part of the world, we need to reach home at 9 and then cook food. So we do use microwave. It's best to heat the food on a stove or a gas on an electric burner rather than a microwave. That's what I advise my patients who are interested in a better, holistic, healthy way of living. Breast cancer, pregnant women. Okay. No, we have not seen pregnant patient diagnosed with breast cancer. However, I have seen women diagnosed with different kinds of lumps of the breast with pregnancy. They do need operative before the patient delivers usually because that's the only way the patient can feed the baby, which is again a very important part to protect her and the baby also. So, but we have seen pregnant women with cervical cancers, liver cancers, and yes, the prognosis does seem to be grim. If it's diagnosed early, it's very helpful. Does the presence of cancer show up in a normal blood test? Okay. So every cell or every kind of type of tumor that happens in the body, they secrete different types of antigens or receptor materials. These are protein kind of structures which are diagnosed by tests. But one general blood test cannot show that you have cancer. So looking at a lump, you then go ahead with different types of tests meant for that specific organ lump. One test will not show cancer at all. Okay, let's see if I have something else. I hope I've been able to answer these questions. If not, I will go back to my slide of the first slide where you can get in touch with me. Just a minute. Okay. So here it is. You can take down my details. You can mail me if needed at any point of time, and I will reply to you as soon as possible. If there are any more questions, you can let me know. Okay, are soy products not good for cancer patients? Okay, as far as soy products go, I would like to say something here. Soya bean has a very good natural source of phytoestrogens, which are actually very good. The only problem with soya bean is the amount of soya milk and the soya beans in the market are not actually natural soya beans. There is a lot of genetically modified soya products available. And that is what makes a problem. And when it's genetically modified, you actually do not know whether it's the right product for you, because if it's genetically modified, it can have substances that will go inside your body and alter the structure of your body's chemical composition. So I would advise stick to organic if you trust that organic brand, or stick to natural products rather than having excessive soya products in your diet. Is there an age restriction to do the mammogram? Yes. As far as I go, I would say that mammograms are done very often by women, especially during the month of October, when you see that just in case the insurance doesn't cover and you want to do it, you're worried about some lump, you go for a mammo. But I would advise only those women after 40 should get mammogram done, or those who are at a risk should get it done from the age of 35. But it's a customized approach. In case you have family members or close members which are more than one and your stress levels have increased, you can get a mammo done. So as I said, there is age restriction of 40. Do two mammos. If it's done early, there has to be a valid reason for it, because mammogram is ultimately a slight exposure to radiation, which we do not want to give to healthy women with healthy breast tissue. Okay, do I see anything else? Okay, does having fibrocystic changes increase chance? Okay, so having fibrocystic changes in the breast does not per se increase your chances, because fibrocystic changes actually lead to benign lumps like fibroadenomas and breast cysts and solitary cysts. They do not per se cause breast cancer, and they do not increase your chances of breast cancer, because as the name suggests, it is fibrous tissue and cystic tissue that is what forms fibrocystic changes. Usually hormones, evening primrose oils, healthy exercise, eating and meditation usually do help in healing women with fibrocystic changes, which can sometimes be painful too. I think I am done with it. Okay. Okay. So if women have breast cancer in their family, then yes, you should get a mammogram done as early as 35 years of age, and yearly breast examination with a clinician, monthly breast examination yourself, which I have shown in the slides, breast self-examination. Is it mandatory for me and my siblings? Okay, so breast examination is mandatory for your siblings and you 110%. You should get it done regularly. And if it runs in the family, BRCA test is usually more definitive. That can help you being more aware about your chances and more aware about your normal health structure. I hope I've answered it. If not, you can get in touch with me.
Thank you very much, everyone, for attending today's session. We appreciate your participation, and I hope that this was very informative.
Thank you so much.
Hi, yeah, sorry, I think Muzaffar's just dropped off. So thanks, this is Sam Hayes from Mercer Marsh. So thank you very much. Personally, I found that very, very informative. And honestly, there's a lot of information that I didn't know before. So thank you so much. And for all of our clients that listened in, we really hope that this is demonstrating that MMB Dubai is really trying to engage with all of our clients around this wellness activity, and we look forward to doing more and more sessions to educate you, to educate your employees about different wellness sessions. So thank you very much, everyone. It was a great session to be part of. Thank you, everyone. It's now fine to leave the seminar. Thank you.